What's up everybody, what's going on? Hope you're all having a fantastic day today. With today's new video, what I wanted to talk about is inversion therapy for someone with lower back pain or any sort of kind of traction kind of therapy in individuals engaging in for their lower back. So that's why I'm kind of doing this video right here with regards to this inversion table. And I actually have previously credited this device as the best accessory tool for my recovery. Now keep in mind, it's not exactly what healed me. It was just a good and useful tool that I noticed significant benefits from. But with that being said, it wasn't always perfect because when I had stopped kind of using the inversion table on a consistent basis, this was more towards post-recovery. And this is when I was specifically working in Toronto with the Toronto Raptors. When I went to use an inversion table, now keep in mind, like I said, I wasn't consistently kind of using one anymore. But a few times when I went to just kind of decompress my spine, upon getting off the inversion table, I had a significant flare-up in my back, and I couldn't walk for about 30 seconds, and I always wondered the reason for this. And it was always a mystery to me of why I experienced this pain, because this was a type of pain that I'd never experienced before. And it was very painful, and it prevented me from moving, but it didn't last long. It only lasted for about 30 seconds to maybe a minute at most, and then it would go away and I'd be completely fine. So, more recently now, I actually heard a podcast, so Chris Duffin's podcast actually, where he was talking with Dr. Stuart McGill, and Dr. Stuart McGill was on, and there was a question that was asked with regards to traction therapy and kind of inversion therapy for people with lower back pain. And I actually heard kind of Dr. McGill give his thoughts regarding it. And so he actually said something interesting that I didn't always kind of quite understand, but it kind of made sense to me, and it clarified to me why I specifically may have experienced back pain at that time after kind of getting off the inversion table. So the key thing to understand, guys, is that when you're engaging in traction therapy or you're hanging upside down on an inversion table, you're creating a traction force that is essentially going to destabilize certain joints and our spinal discs when we're engaging in that traction therapy and opening everything up. So everything's kind of becoming destabilized. So as things become destabilized now, and especially if we have maybe an unstable disc or maybe have arthritic facet joints that just aren't stable, and upon maybe getting off the inversion table and trying to walk around, those various micro movements in the lower back now that may cause some sort of flare up, and it could cause an individual to experience pain because the joints may be really cranky and now they're unstable. There could be some sort of micro movement or micro trauma that occurs that can cause a significant flare up within an individual. So when it comes to traction, the thing is, people do need to be careful with regards to it because it's not for everyone, and I've mentioned this in a lot of my previous videos, that traction therapy, inversion therapy, it's not for everyone, but it is for some, and for those individuals that have that sufficient stability and don't have problems with engaging in any kind of traction therapy, there can be significant benefits for those individuals, specifically for relieving pain in individuals that may have nerve pain or maybe a herniated disc just kind of impinging on a nerve root. Could maybe reduce some of the pressure there that is kind of impinging on that nerve root and cause some relief in individuals. And I've also mentioned how I believe it could be effective in someone's recovery if combined with stomach lying, just when an individual uses the inversion table and they jump into stomach lying afterwards. And my belief is that gravity could maybe pull the nucleus material back into place. But like I said though, while there's benefits for some individuals, it's not for everybody, because by creating that traction force, you're going to be creating a destabilization effect that if someone doesn't have sufficient stability at the certain disc level or at facet joints, upon getting off of it and engaging in maybe certain micro movements, maybe trying to walk or whatnot, that can create a significant maybe onset of pain or flare up for an individual. And these types of individuals need to be careful. So, with regards to kind of my recommendations or suggestions, guys, when it comes to engaging in inversion therapy, and if you're unsure if it's for you, you would probably want to consult or deal with an experienced clinician who actually deals with lower back pain and can give you a proper assessment and actually can determine if this type of therapy is appropriate for you. But at the same time, also maybe just trying this device out before maybe purchasing something like this, just to see its effects and to see how maybe you respond to traction therapy. Because if you engage in that kind of traction or decompression, and if it does trigger an onset of pain for you, then that's your first indication that this type of therapy is probably not appropriate for you, at least at this time. And it's either best to wait until maybe things kind of settle down with regards to your lower back and you build up the sufficient stability, or maybe your rehab program, there's just maybe a different kind of strategy or approach to it. So those are just kind of my recommendations when it comes to inversion therapy and whatnot, guys. And I just wanted to kind of share that with you guys because I heard Dr. McGill talk about that, and it kind of clarified things to me because I always was kind of wondering why I had experienced pain a few times just after using the inversion table and trying to walk around. I always wondered why it was a different kind of onset of pain. Now, I don't experience this anymore. I'm totally fine. You can use an inversion table, no problem. But just wanted to share that with you guys, and I hope this is kind of just a useful tip that some of you can benefit from, or if you guys are unsure about inversion therapy or using an inversion table, I hope this kind of clarifies things for you guys. Okay guys, so if you have any questions, comments, or anything, please leave them below. And with that being said, we'll wrap up this video. And until next time, take care.